Every week, I am contacted by people struggling with the aftermath of trauma. Most have tried many forms of therapy and seen multiple therapists. Many describe themselves as desperate and ready to do whatever it takes to get help. I have come to see that lack of good information about trauma is one of the biggest obstacles to dealing with it for most of these survivors. So here's a quick compendium of info, presented in the form of a loosely organized glossary of terms and concepts that every survivor and trauma therapist should know. Rather than alphabetical order, I've placed them in what I consider order of importance, starting with those terms I think are most urgent for people to understand. Psychoeducation is education and information about mental health. In the context of trauma, psychoeducation should inform about the cognitive, physical, emotional, spiritual, and social effects of trauma on survivors and families, individual trauma, and communities, communal trauma. Why is this important to understand? Psychoeducation is so useful that even without additional intervention, it has been found to increase quality of life after trauma among trauma survivors. Survivors need information about what happened to them and how the injury of trauma affects them. Without this understanding, survivors often feel that something is wrong with them, that they need to be fixed. Psychoeducation enables survivors to recognize that they are not broken. Rather, they are experiencing a predictable set of symptoms, a normal response to an abnormal situation. These symptoms can be difficult to live with, but they evolve to assist human survival and are easier to manage when understood in this light. Psychoeducation is also important to help survivors understand strategies required to sustain progress achieved in therapy. Trauma integration is not a matter of healing and moving on. Careful life management is required. Psychological trauma is a response involving complex debilitation of adaptive abilities, emotional, cognitive, physical, spiritual, and social, following an event that was perceived by our nervous system as life-threatening to oneself, for others, especially loved ones. Trauma can be a one-time event, a prolonged event, or a series of events. Trauma that affects a community or a country is called collective trauma. Traumatic injury shocks and changes all systems. These include cognitive. The trauma affects the ability to process thoughts and make good judgments. Emotional. Looping with emotions of shame, guilt, fear, anger, and pain. Physical. It affects muscles, joints, digestion and metabolism, temperature, sleep, immune system, etc. Spiritual. The trauma affects our worldview, the lenses with which we see reality, typically so we see it as unsafe, our understanding and meaning of life, society, and the world, social. The trauma affects relationships with spouses, family, friends, colleagues, and strangers because it affects so many so deeply. It affects structures of societies. Post-traumatic stress disorder (PTSD) is a set of alarm responses that occur when a survivor's nervous system remains on high alert after trauma in order to protect against further harm. The survivor's alert systems respond to reminders of the traumatic memories as a threat. Often, additional triggers are added to a growing list of stressors. Developmental trauma occurs early in life and disrupts normal sequences of brain development. As a result, other aspects of development such as emotional, physical, cognitive, and social are also impacted. In the first years of life, the brain develops from the bottom upwards. Lower parts of the brain are responsible for functions dedicated to ensuring survival and responding to stress. Upper parts of the brain are responsible for executive functions, like making sense of what you are experiencing or exercising moral judgment. Development of the upper parts depends upon prior development of lower parts. In other words, the brain is meant to develop like a ladder, from the bottom up. So, when stress responses, typically due to persistent neglect or abuse, are repeatedly activated over an extended period in an infant or toddler or young child, sequential development of the brain is disturbed. The ladder develops, but foundational steps are missing, and many things that follow are out of kilter. Unaddressed developmental trauma can manifest in many ways. The most common psychological diagnoses that follow are bipolar disorder, personality disorders especially borderline, ADHD, oppositional defiant disorder, learning disabilities, social disabilities, addictions, eating disorders, depression, anxiety, complex PTSD, and so forth. Our memories are stored in explicit and implicit ways. Explicit memories are verbal ones, conscious. We are aware of the facts and can typically recall them in a way that has order, story, event, people that we know, a certain location, etc. Traumatic memories are implicit, autonomic. These are stored in an unconscious, fragmented form. They bear no sense of order or even a connection among themselves. They can, however, be easily activated by inputs from our senses in the present moment, causing us to intensely experience reminders of something that happened to us in the past. Since traumatic memories are implicit, trauma therapy should in the beginning focus on bottom-up modalities that target areas of the brain known to store implicit memories. As trauma integration progresses, it becomes possible to engage with top-down modalities to process the narrative of the traumatic event per second. Bottom-up modalities are experiential ways of engaging survivors with a focus on enhancing self-regulation through body awareness and expanding a survivor's sense of control and ability to tolerate inner and outer triggers. Examples of bottom-up modalities are expressive therapies, arts, drama, movement, dance, music, body-oriented therapies, certain mindful modalities, and certain neurofeedback protocols. These modalities include use of talk to process the dynamics of therapy, but they do not rely on cognitive processing. Body awareness means learning to detect and trace what is happening in the body. It's particularly important to understand what sensations are associated with various triggers, emotions, movements, associations, images, etc. Self-regulation is the ability to control one's emotional responses. Self-regulation in the context of trauma therapy focuses on 3 dimensions: sensory regulation, integration, expanding control in response to sensorial triggers and alerts; emotional regulation, expanding control over one's emotions; cognitive regulation, expanding control over thoughts and increasing capacity to respond rather than to react. Top-down modalities usually refers to talk-based therapies, such as cognitive and behavioral therapy (CBT) modalities. Top-down modalities focus on thought processing and reframing, behavioral modifications, emotional processing, and some forms of narrative processing. Some top-down approaches combine modalities. For example, mindfulness-based cognitive therapy, mindlessness versus mindfulness. Both are practices that can increase the ability to quiet an alerted nervous system. However, mindfulness is a mental state that focuses on awareness of what is here and now, present moment sensations, feelings, thoughts, whereas mindlessness brings attention to focus on a task or activity and seeks to be fully absorbed by it. Mindfulness can be very challenging for trauma survivors since, along with awareness of the present, can come expanded awareness of sensitivity to certain sounds, smells, or textures. These sensitivities, known as triggers and alerts, torment many survivors by bringing to the surface unwanted memories and a flood of emotions. If not developed slowly and gradually, mindfulness can cause more harm than good. Intentional mindlessness that incorporates creative activity can be just as calming to the nervous system as mindfulness, and engaging in it enhances the ability to be spontaneous. When practicing intentional mindlessness, we want to engage in activity that fully absorbs us and during which the mind doesn't flit to other thoughts or to what we are thinking and feeling, and that increases our sense of joy. Typically activities, playing games, scribbling and doodling, exercise, and so forth. Imaginal space is an abstract, creative space of play, fantasy, and spontaneity in which a trauma survivor is able to explore and engage with different aspects of her experiences, including traumatic ones through art, play, movement, dance, drama, music, and so forth. In imaginal space, we encourage expanded spontaneity. If trauma is a frozen moment in time, then spontaneity is the antidote. Trauma processing. Many trauma survivors seem to expect that if only they will be able to tell their story, they will be healed. A heavy focus on telling the traumatic story reflects outdated notions of what trauma does to people and how to respond to it. Since traumatic memories are implicit and somatic, face-to-face, talk-based processing of trauma is not the best way to go about therapy. Telling the story of the traumatic event is not necessary to enable clients to bring up and process what they experienced. The pain of trauma will emerge in whatever modalities are being used. The key concern that must guide a therapist is how to enable it to emerge in manageable ways that do not cause more harm. Resilience is a set of individual responses that enable survival in the face of adversity. The mere fact of survival is evidence already of resilience, and individuals display a variety of other survival responses depending on their circumstances. A key challenge in therapy is helping survivors discover their existing resilience. Most survivors are more resilient than they give themselves credit for. When we add up all the displays of resources demonstrated across hours, days, weeks, and months, in spite of the difficulties of trauma, we see a rich, ongoing web of creative resources that have enabled survival. Post-traumatic growth (PTG) is a meaning-making process following trauma. Though the original definition is different from my own, I have observed that some survivors come to terms with their experience through a process of meaning-making that typically includes action, making a conscious choice to get help, including self-help, reflection, finding meaning in what has happened to me, in what I am doing about it, and in valuing things that have resulted in my life from having to cope with trauma. Contemplation, how to incorporate the meaning I have gained into my daily and future actions. What to do right after trauma takes place. Therapy should not be the first line of response after trauma takes place. Survivors cope better with the aftermath of trauma if they are given caring support and rest rather than encouragement to talk about and reflect on what happened. Just after trauma, telling and retelling the story is now recognized to be counterproductive and even harmful. As an alternative, psychological first aid (PFA) is a short-term set of support strategies that can be provided by anyone, clinician or not, who has gone through training for it, to support survivors. PFA has been found to be effective in mitigating stress responses and assisting survivors in developing skills for coping with the after effects of trauma. Aspects of self-sustainability. Trauma integration is as much or more about building a stable, meaningful life in the present as it is about moving out of the grip of the past. It's essential for survivors to develop and maintain practices that support meaningful life in the present. Key categories of routine practices include experiencing the joy of immediate gratification, even if the purpose is no larger than feeling good in the moment, such as watching a movie, getting a massage, getting a mani-pedi, meeting friends, etc. Keeping routines of self-care, including exercise, sleep, diet, interacting with loved ones, etc. Reflection on practices of self-sustainability. Because trauma survivors are more vulnerable than others to the stresses of daily living. Ongoing monitoring and adjustment of self-sustenance practices is important. A therapist can contribute to this by working with a client in reflecting on what is working and not working and why. Observing intentions, stimuli, and sensations, both internal and external, and learning from these observations. Individualized Sustainability Plan (ISP) is a blend of strategies and practices to maintain the process of trauma integration. An individual sustainability plan (ISP) provides ongoing structure after we've done essential preliminary work on connecting to inner resources and establishing a sense of safety. An ISP incorporates routines that target all aspects of wellness: emotional, cognitive, physical, spiritual, and social, such as mindfulness and self-compassion practices, sensory and bilateral integration, sport and movement, cognitive reframing, behavioral modifications, expressive arts, brain training, neurofeedback, diet, and nutrition.